Hello and welcome to Legislative Report. I'm State Senator Mario Scavello, the 40th Senate District, Monroe and Northampton County. And today I'm at Audiology Services. I'm with Blaise Delfino and Dr. Gregory Delfino. And what a pleasure to be here with both of you. And I came here for I forget what it was, and we started talking. I said, what a great idea for a show here, to let people know how important it is to get your ears tested and from professionals, not just put something in your ear thinking that everything is okay, because you might have some problem in your ear, am I correct, that might not show up by putting these over-the-counter earplugs in, basically. So want to talk about that a little bit? Sure.
Senator Scavello, again, thank you so much for coming to Audiology Services. You were actually at our 5-year ribbon cutting for this specific location in 2015. And then a couple months ago, you came to the office and we had talked about the importance of visiting a licensed audiologist and/or hearing healthcare specialist, and really what the landscape currently looks like within the hearing healthcare space. And there's a lot of great stuff happening in the hearing healthcare industry, but a lot of threats that are currently happening, and that being the over-the-counter acts of a self-fitting amplifier. And of course, we are here with Dr. Gregory Delfino. We are a family-operated and owned audiology practice. But Dr. Delfino, why don't you dive in first? Let's hear, you've been an audiologist for over 35 years, and the importance of visiting a hearing healthcare professional and why patients should avoid purchasing these self-fit hearing instruments over the counter.
The sense of hearing and audition is one of the greatest ways in which we are able to communicate with one another, and to have some disruption in that communication affects not only the individual but their entire family. So hearing loss isn't just about the individual but about all those that are surrounding them. Hearing loss is one of those very insidious types of maladies where it's difficult to realize you've got a hearing loss. It takes many years to come to grips with the fact that there is some diminution in hearing sensitivity, and it takes about 7 to 10 years before someone even does something about it. So the fact that we've gotten to the point in audiology where newborn hearing screening is such an important aspect of it, because we realize that the earlier we are able to detect hearing loss, the better we're able to treat individuals with that hearing loss. The same is true with the adult population. And so, oftentimes the primary care physicians will either overlook or not think about making a referral for a hearing test, and it's really part of their role as a gatekeeper to let their patients know that this is an area where over the age of 50, we need to have our hearing tested to make sure that there is no reduction in our ability to hear and understand speech. The concept of an over-the-counter hearing aid, I think the concept is really well worth looking into, simply because it has to do with accessibility. Having individuals having access to instruments. My only concern about an over-the-counter product is that it runs the risk of being put in the hands of its unintended users. The intended user is someone with a mild to moderate degree of hearing loss, anywhere from 25 to 55 decibels of hearing loss. And that is the majority of the adult population that has hearing loss. Unfortunately, the number of individuals that are adopting hearing aid is about 14%. So it's not a population that's running out and purchasing instruments, but certainly the largest number of people that require amplification. And so that's what this classification of over-the-counter or self-fit hearing aids is going to help. Again, my concern is by not including some direction, some instruction from a professional, they run the risk, these unintended users, of purchasing something that is not going to be useful to them, is going to lower their expectations of a traditional type of hearing aid. It unfortunately, I think, lengthens the time in which someone actually does something about their hearing loss. So we go from 7 to 10 to, I've tried it over the counter and I disliked it so much, I'm going to wait another 3 or 4 years. So that's one of my real concerns about the over-the-counter push.
And when you examine, sometimes you find other issues, correct? When you're that you wouldn't find if you bought something over the counter.
Surely. I mean, anytime a patient interacts with someone who's not a professional, that's not even looking in the ear canal or not testing what's going on, you do run the risk of ear canal being blocked with cerumen earwax, a deformity, an acoustic neuroma, tumor, individuals with central auditory processing, with cognitive decline. All of those conditions which need to be addressed are left unattended for a greater length of time. Again, another reason why I think the interjection, the absolute essential portion of getting hearing help, has got to be done through a hearing professional.
So if you just go to a place and get these over-the-counter stuff, it doesn't necessarily, just to recap, it doesn't necessarily, it doesn't make you hear better probably, but it's really not helping you if it's not fitting properly, and you really don't know what the issue might be that's causing the ear loss.
Correct. And if we look at the numbers, the majority of the major hearing aid manufacturers invest close to $90 million every single year into research and development. So hearing aids, traditional hearing aids, the hearing aids that we fit our patients with, have something called digital noise reduction. And it allows patients to increase speech understanding, it decreases their listening effort. And these companies like Oticon and Starkey and Sonic, they are investing millions of dollars into products to better the lives of our patients. And we are here to raise awareness of the importance of visiting a hearing healthcare professional. And when you do purchase self-fit amplifiers online, which they can't legally be considered hearing aids right now, you are not receiving a comprehensive hearing healthcare evaluation. One of our good friends and colleagues, Dr. Douglas Beck, who's the Vice President of Academic Sciences at Oticon, we just recently talked about the importance of speech and noise testing.
Sure.
We have some patients who present with hidden hearing loss, normal hearing sensitivity, but difficulty understanding speech and noise, and oftentimes those patients present with central auditory processing disorder. And so we are here to simply raise awareness about the importance of visiting a hearing healthcare professional. We were talking prior to the show of, I wouldn't buy a denture kit online or a root canal kit online. So the importance of visiting a trusted hearing healthcare professional to assist you on the road to better hearing is really, really important.
So if you've got a hearing problem, don't go over the counter, get your ears checked first before you do anything else.
Absolutely, because a lot of, the biggest thing now with the over-the-counter push is that you're not receiving a hearing test. And the hearing test that you would be receiving online would essentially be subpar to that of visiting a trusted audiologist. If you want to echo that, Dr. Delfino.
Yeah, and you know, this, using the nomenclature of a self-fit over-the-counter hearing aid, that in and of itself says lots about what this process is about. You're getting subpar audiometric data, which is going to be inputted into the matrix of this hearing aid. It's going to be shipped to the customer. They are going to try and figure out, how does this work? It is, you know, I've been in this business over 35 years. Blaise and I have worked very closely together. When everything really works well, we still find the fact that the amount of data that we've gotten still needs to be tweaked or changed to get it to where that the patient is pleased with what's going on. I can't even imagine what this would be like, having someone frustrated sitting at home trying to self-fit an instrument that is so complex. The frustration level is certainly going to stop them from moving forward, and that's my concern.
In the long run, you're pretty much saying is that the patient would regret buying something that doesn't really meet their needs.
Exactly, and you know, the regret sometimes is the rationale perhaps of someone buying an over-the-counter is that it's less expensive or it's more accessible, and the reality is that the over-the-counter instruments may be less expensive to some degree, but they are certainly not an inexpensive way to handle hearing loss. We've got instruments that fall well within the range of an over-the-counter instrument, but what comes with them is the professional care and the service and the assurance that what you're purchasing is correct and will work. This is not something that's going to be sitting in your drawer. This is something you're going to be able to, and your family will enjoy your company, your ability to talk with them to a much greater extent.
Yeah. But why children? Why is it so important to test them early?
As I said earlier, the whole concept of a newborn hearing screening is essential because we know that without audition or without hearing in a child, they pass through this critical language learning period without the ability to hear and understand speech. They cannot distinguish between phonemes, vowel sounds, so language is not developed. Children with hearing impairment suffer that same consequence, that if they're unable to hear a clear speech signal, they can't develop speech and language well. The over-the-counter product is certainly not something, and it's clearly outlined in the FDA rules and regulations that it must be 18 years of age or older. But again, the concern is some unintended but possible users could order something online for a child in the hopes of helping their child hear, and that is a significant error in judgment, because children's ear canals are smaller unless you've taken the kinds of precautions so that you know that you're not over amplifying or damaging their hearing, or even setting it up in a way that it's going to help the child. It really is a disservice to the child.
Wow. You know, I know we discussed it, but let's your practice. Let's go over all the service that you do here with somebody who walks in here and has a hearing problem.
Sure. So whether you're a new patient or a current patient, we urge our listeners right now to get your hearing tested every single year. So let's just say, Senator Scavello, you schedule an appointment with our patient care coordinator, Jasmine. You walk in. Number one, you're greeted exceptionally well because we treat our patients like family. But in terms of the test battery, the protocol, video otoscopy, so our patients are able to see their eardrum on the big screen. Wow. It allows us to see, is there any scarring on the eardrum? Is there any discharge? Does this patient present with a perforated tympanic membrane or eardrum? Is the presence of a cholesteatoma present, if you will? Then we test tympanometry, and what tympanometry does is it measures the middle ear pressure, and what we want to see is the middle ear pressure in front of the eardrum equal to that of the pressure behind the eardrum. This allows us to see, are the three smallest bones in the body disarticulating with each other? Is there fluid in the ear? Is there a perforation on the eardrum that we can't see with video otoscopy? We then test what's called otoacoustic emissions. And what otoacoustic emissions is it really displays to us our inner ear function. It's an objective verification for us to test that inner ear function. Then what we do is we run a full hearing evaluation on our patient, which includes pure tone audiometry, speech audiometry, bone conduction, speech and quiet testing. But the most important, and what my father and I always agree on, is speech in noise testing. Most individuals can hear, but not everyone can understand what is being said. And only 15% of audiologists and/or hearing healthcare professionals conduct speech and noise testing. Once we run through this entire battery of audiological testing, the patients come into the technology suite, and we briefly review the anatomy of the ear and their type and degree of hearing loss, the sounds that they have difficulty understanding, and what their treatment options are. We always let our patients know we need to fit you to your type and degree of hearing loss and to the need of the patient. We never fit to the pocketbook. And that is really important because the big push for over-the-counter hearing technology is that hearing aids cost so much and that affordable options have never been available. Well, that is really incorrect, and that's a misconception. One of our friends and colleagues, Dr. Amit Gasalia in Los Angeles, he was just on Fox LA, and he had reported that he has hearing aids that he fits on patients for $750 for the pair. Mm-hmm. We have technology that we fit our patients for $899 for the pair. Mm-hmm. Real hearing instruments fit by professionals. So to kind of put the entire test battery into a small segment, that is what we provide to our patients. Dr. Delfino, I don't know if you want to add anything else to that.
The overall concept here is that in order for us to correctly fit someone with amplification or to assess their hearing sensitivity, I need as much information as is possible, and we collect a huge amount of data, and that's because it plays its role in everything that we do with regard to fitting someone with a hearing aid or making a referral. Anyone that's involved with hearing or hearing loss, your goal should be, let us replicate hearing to the most normal level as is possible. And in order for me to do that, I need to be able to get as much information about what the pathology looks like, how does it react, and then what do we do to work with that pathology so that sound is natural, is comfortable. And the other issue is we do verification. I don't ever have to ask a patient, how does this sound? We do what's called real ear or in situ measurement, whereby we're placing probe microphones down into their ear canals, we're measuring sound pressure level, we're looking at how well a sound is appearing in their ear, we're setting targets, we're adjusting on the fly, in situ, as this is going on, so that when we've hit target, Blaise and I will look at each other and say, that's it, and we never have to ask the patient, how does it sound? We know it sounds right.
Absolutely.
Wow.
I think it's important to echo Dr. Delfino. We always stress to our patients that we don't necessarily hear with our ears, we hear with our brain. And untreated hearing loss is linked to cognitive decline, increased risk of depression, anxiety, social isolation. Individuals who present with diabetes are at an increased risk of hearing loss. Individuals who smoke are at an increased risk of hearing loss. So there are so many comorbidities that are linked to untreated hearing loss that if you purchase over the counter, you might just be fixing a symptom versus a cause. So we do implement best practices and a high standard of care here at Audiology Services, and again, to raise awareness of the importance of getting your hearing tested every single year and being fit with hearing technology by a licensed audiologist and or hearing healthcare professional.
You know, I was going to ask a question on dementia. You didn't mention it, but in your comments,
yes.
You just didn't mention it right now. You know that.
Yes.
So thank you for leaving that door open for me, because I was shocked about that it can affect dementia, improper hearing.
Absolutely. When you consider, you're talking about auditory deprivation, the inability to hear sounds, to understand words. We talk about attrition and atrophy of those brain cells that are responsible for it. There is certainly some attempt for the brain to rewire and some attempts for some plasticity, but again, that atrophy is certainly part of how well we cognitively function.
Wow.
Individuals with severe hearing loss are 4 to 5 times more likely to experience cognitive decline or dementia of the Alzheimer's type. So hearing loss is something that we really need to raise awareness about. You know, most of the patients that we see, Mr. Smith, when was your last hearing test? Well, high school. Mm-hmm. Unless they worked in a factory, and that shouldn't be. Everyone should be getting their hearing tested every single year. And of course, cognitive reserve, that's something that we were talking about with our friend and colleague, Dr. Douglas Beck, is yes, we hear with our ears, but we really do hear with our brain. And to fit our patients with hearing technology, we want to implement that cognitive reserve. We want to maintain the cognitive faculties that our patients do have. And of course, yes, we are accessible here, and accessibility is something that we truly believe here at Audiology Services.
Impressive. You know, it takes something from it to another level where people don't realize they're not getting the right, by going and buying something that you're not fitted properly, the negative stuff that can happen to you versus coming to a professional and getting all of these tests. And from year to year, you're saying you should really check.
Every single year. And just to bring up the accessibility aspect of it, because that's something that's been reported with the over-the-counter legislature, is that hearing aids haven't been accessible. Well, the Starkey Hearing Foundation for well over 20 years has been fitting patients who can't otherwise afford hearing aids with hearing instruments. And we are part of that Starkey Hearing Foundation. So if a patient comes to us and they cannot otherwise afford hearing technology, they of course have to submit an application. It's a $150 application fee, I believe, but we don't get paid to do that. We fit our patients with hearing technology for free. So hearing aids have been accessible. So it's important that we raise awareness of that. Also, the majority, like the Oticon Foundation, the Starkey Hearing Foundation, these major manufacturers have these foundations. So it's time for us to raise awareness. That would help with the cost of, hearing instrumentation. But we always say that the cost of untreated hearing loss is greater than that of the price of the hearing technology.
Wow. You know, and this is going back a while, my chief of staff is here, but there was someone in my district, she lived in Foxfire, and she, somehow or other, she misplaced her hearing aids. And this is going back now about 15 years ago. And I purchased a pair for her. I called the doctor in Stroudsburg, and to help her.
Wow.
Because
that's amazing.
Because sometimes you get that say, you know what, let me help her.
Absolutely.
Because
Absolutely.
without the hearing aids, she was she couldn't do anything. And when she put them in and started to hear, she started to cry.
Yeah, and it's an amazing. Thank you for doing that. One of our favorite books is The Go-Giver. The more you give, the more people you can help. We always talk about providing the gift of hearing. What gift are you providing to individuals on a daily basis? And we get to provide and give the gift of hearing to patients on a daily basis. So it's really incredible.
When you're in that position to help somebody, you do it. That's what it's all about. Dr. Delfino, talk about what you were able to do as a practice, the tool that you came up with that's patented, if you don't mind.
Well, at Audiology Services, we're not just about hearing loss, but also hearing prevention. And to that, we owe a great debt of gratitude to my son Blaise, who had invented and has a patent on a product that's called fader plugs. Blaise, describe for everyone what this incredible instrument does.
Sure. So the fader plug is the world's first custom adjustable earplug. So if you're at a concert, you might see individuals wearing foam earplugs. Well, they block out all sound. It's not a nice listening experience, if you will. They're big, they're bulky. With the fader plug, what you're able to do, it's custom fit to the ear, and it has a valving system. So if we're at a concert, Senator, and you're talking to me, well, I'll open up the valve system. I'll be able to better understand what you're saying. Okay, you want a Coke and a burger? I got you after this next song. I'm going to close up that valve system, enjoy the rest of the song while I'm protecting my hearing, and then I'm going to go get those those beverages. But the fader plug allows the user to put themselves in a comfortable listening situation without ever having to take the device out of the ear. So the patent was issued in September of 2020. And we are just so grateful and excited to help individuals on the road to better hearing. So while we are fitting patients with hearing technology, providing the gift of hearing, we also believe in preventing hearing loss. That's something that we really do believe in, and that's a product that I worked on in graduate school, and it's not just a me product. There's so much credit. We have an entire team behind us. And Dr. Delfino, if you want to touch upon the research that we conducted with Dr. Grant Searchfield at the University of Auckland in New Zealand briefly.
So we wanted to see how well this functioned in a number of situations. Myself, I spent lots of time in my early career as a pediatric audiologist, and so I had always had run across patients, parents who were concerned about children with hyperacusis, sensitivity to sound, and I thought it would surely be nice to be able to have a sound attenuator where I could adjust the valving, because some children, I don't want to deprive them of sound. I want to reduce some of that sound so that if they want to go to the movies or if they want to go to a party, the child or the parent can have some control of how much loudness they are going to receive. And so fader plugs was the exact product that I had envisioned in my mind, and Blaise had put it together. The information that was gathered at the University of Auckland was on a population of folks who are hyperacusis, very sensitive to loud sounds. And again, this is a population that you don't want to deprive them completely of sound, but you want to be able to allow them to meter or monitor the amount of sound that's coming into their ears. And so fader plugs does that exactly as it should. If an individual is at home and someone is making a sound, lip slapping or like chalk on a blackboard, they are able to reduce that volume by themselves to make it comfortable for them. They can do it both the right ear and the left ear. So it really creates a tremendous amount of comfort and protection for both children and adults. And I'm so excited to be part of this product.
You know, the NASCAR track, I'm thinking about as you're saying, and
Yep.
my gosh,
Yes.
you can't
Nope.
you can't stick enough stuff in your ear.
Loud.
Right?
Very loud. And we're also excited to announce that we will be opening the Lehigh Valley's first ear mold lab to ever exist with our partner ProtoCam. They're located in Allentown. That's something we're very excited about. But
Wow.
So we're not only about solutions, but also preventative healthcare when it comes to hearing healthcare.
You know, we talked earlier about every year you should get your ears tested. And, you know, for someone that has insurance, I can understand that, you know, they'll do it. But how about people that don't? What's the cost and what does that test entail with people?
So if you do have insurance, insurance does cover the hearing evaluation on an annual basis. Now, in terms of how much does a hearing test cost, that really does vary from practice to practice. So hearing test in New York might be less expensive than that of a hearing test in Pennsylvania or New Jersey. Hearing tests can range anywhere from $65 for the evaluation to $125 for the evaluation.
That's good.
We get a lot of questions in terms of, does insurance cover the hearing instruments? In some cases, some of our patients do have that full coverage when it comes to hearing technology. Others have partial coverage. Majority have really no coverage. But that is why we've implemented different service plans here at Audiology Services. We offer a leasing program.
Nice.
So patients can lease hearing technology and then at 4 or 5 years upgrade to newer technology, like similar to that of leasing a vehicle, but very different. This is a medical device. And then we also do offer financing options as well. Again, we never want to put our patients in a financially compromised situation. Our goal is here to assist them on the road to better hearing.
Wow. Look, I just want you to know that I've just got an education on this side.
Good.
And I think the folks at home also are going to realize.
That's great.
I have to tell you, I don't know the last time I had my hearing tested. And I'm going to come down and get it tested.
Where do you get that
make a
schedule
schedule
today?
We'll get the schedule, Christine. Maybe we'll do it together. But, no, because you just never know. You never know if you have a problem, and you want to make sure that that you're okay. And for the folks that are going to be viewing this, if you haven't had your ears tested, you think everything is fine, and maybe take that opportunity and get your ears tested. And I think it's a reasonable number, and if you've got the benefit, then go ahead and use it.
And oftentimes, a few times a year, we will conduct open clinics where we'll conduct complimentary hearing screenings here in the office. So it's free.
Wow. Okay. Well,
Senator Scavello, thank you so much for having us. Thank
my
you.
pleasure.
Senator,
My
thank you
pleasure,
so much.
Doctor.
It's a pleasure.
Okay. You've been listening to Legislative Report. I'm State Senator Mario Scavello, the 40th Senate District. If you have any questions about this show, please contact my office or contact their office. The number will be on the screen in a moment. And thanks for watching, and see you next time at Legislative Report.